Do you find yourself not as happy as before? Not as interested in intimacy with your spouse anymore? Times like that, have you ever wondered, is it because of old age? Or is there something else that we haven't realized yet? I used to think like you, that after 60, everything just gradually goes downhill. But then, I discovered something that really surprised me. It's medicine. Some medicines we take every day to treat blood pressure, heart disease, diabetes, can actually extinguish the fire of emotions. No longer wanting to be intimate, no longer feeling happy, body tired, empty mood. Are you taking those medicines? Please comment and share under this video, because who knows, there might be someone else who is like you. And now, I'm going to highlight the 5 most common drugs that silently reduce libido, mood, and quality of life in older adults. Did you know, in our old age, we often start each day with a glass of warm water and a few pills, medicines to stabilize blood pressure, heart medicine, stroke prevention medicine, sleep aid medicine. Maybe you are like me, taking your medicine on time every day regularly as a survival habit. But few people know that the pills we trust every day can also silently drain our emotions if not properly monitored. According to statistics, more than 60% of the elderly are using at least 3 types of medicine every day. And among them, there are types that can reduce the body's natural hormones, making us tired, sleepless, and even no longer feel joy in being close to our partner. Many people silently endure, thinking, maybe it's because I'm old. When you get older, you have to accept it. But no, my friend, sometimes it's not your age, it's the medication. However, I have to make this clear. This is not advice to stop taking your medication immediately. Every medication exists for a reason. Every prescription has a role to play in keeping you healthy. But the important thing is to know clearly to understand. Understand to talk back to your doctor. And understand so your family can accompany you in the right way, more gently and lovingly. Because health is not just about blood pressure, heart rate, or blood sugar. It is also about spirit, emotions, and happiness when living each day to the fullest. You see, there are very small things like a pill that can change our mood and our lives every day. And if we don't pay attention, those changes will gradually become normal. And we think that we are getting weaker, we are getting old. But in reality, that's not the case. There are drugs, very popular, very familiar, still prescribed every day, that can silently cause major impacts on the emotions, physiology, and spirit of the elderly. And now, I invite you to join me in exploring the list of 5 such drugs. Not to make you worry or panic, but to help you understand better, be more proactive, and live healthier. Because only when we know the cause can we change the way we take care of ourselves properly and safely. So, which 5 drugs are being warned about the most for their effects on emotions and physiology in old age? Let's get started right away. The first drug on this list is a drug used to help us stabilize our emotions. It is a group of antidepressants called SSRIs, with popular brand names such as sertraline or fluoxetine. In young people, this drug helps relieve anxiety, depression, helps stabilize the mind, and make thinking clearer. But in older people, the story is different. When used long-term, SSRIs can oversuppress serotonin, a neurotransmitter responsible for creating positive emotions such as joy, love, and attachment. As a result, many people fall into a state of emotional numbness. No longer sad, but also not happy. No more crying, but also not laughing. Feels like living in a thin fog. Everything is quiet, dim, unclear. Some people describe it as, I don't feel sad, but I don't feel anything either. That makes life boring. And even the feelings of closeness and love with your partner gradually fade. not because love is gone, but because emotions are no longer working the way they used to. If you or a loved one are taking this class of drugs, don't panic or stop taking them on your own. What you need to do is talk to your doctor about the emotional changes you're experiencing. Sometimes just adjusting the dose or switching to a more compatible medication can help you maintain both your mental and emotional health in everyday life. And most importantly, you're not alone in this journey. The second type of drug is a very familiar name to the elderly. It is a drug to treat high blood pressure beta blockers, with common drug names such as atenolol or metoprolol. The main use of the drug is to slow the heart rate, reduce the burden on the cardiovascular system, and stabilize blood pressure. But have you noticed? Many people, after taking the drug, start to feel tired, sleepy, yawn continuously, don't want to talk, don't want to do anything, feel like the body is drained of energy. That's not because of laziness or old age, but it could be a side effect of the drug. When the drug slows the heart rate too much, it also affects the body's metabolic rate, making us feel heavy, lifeless, and gradually lose interest in daily activities. Walking is no longer fun, no longer feels the need to garden, read, or talk, and even the desire to be close to your partner gradually disappears. But remember, this is an important medicine necessary to protect the cardiovascular system. However, if you feel a significant change in your body after taking it, be bold to tell your doctor. Your doctor may adjust the dosage or switch to another medicine that causes less fatigue. Because at this age, we not only need to live long but also to live happily, live healthily, and live emotionally. The third type of drug is the type that many seniors are taking every night to sleep better. It is a group of sedatives and sleep-inducing drugs. The scientific name is benzodiazepine. Familiar types are diazepam, commonly known as Valium, or lorazepam. And as the name suggests, this drug helps calm the nervous system, helping you fall asleep more easily. But the price to pay is sometimes greater than that sleep. Have you ever found yourself waking up in the morning with a foggy mind? Your body feels sluggish, you can't concentrate on talking, and all day you just want to lie down, no longer interested in anything. That is the common side effect of this group of sedatives. Because when taken, the drug inhibits the activity of the central nervous system, causing the brain to slow down. And when used for a long time, the body can easily fall into a state of lethargy and lack of vitality. Some people also lose short-term memory, are forgetful, even lose initiative in the smallest things, like cooking, shopping, taking care of themselves. And of course, the desire for intimacy with your spouse, a very sacred thing in old age, also gradually fades away, not because you no longer love, but because your body has been lulled emotionally by the drug. If abused or used for a long time, this drug can easily become addictive and weaken your natural sleep over time. The solution here is not to stop taking it immediately, but to discuss it thoroughly with your doctor. You can replace it with a milder method such as natural sleep therapy, or a new generation of drugs that cause less daytime sleepiness. Because sleep is very important, but being awake to live happily, live fully, is even more important. Fourth is opioid pain relievers. Old age pain is something that almost no one can avoid. Joints, spine, or after an operation. And then, to feel better, many people are prescribed strong painkillers in a group called opioids. Familiar names like tramadol or morphine. These pills are really powerful. Quick pain relief, almost instantaneous effect. But, my dear friend, the stronger the thing, the higher the price to pay. When using opioids for a long time, the body gets used to the drug, and then you need a higher dose to achieve the same effect. That is called drug dependence. But that's not all. Opioids not only numb the feeling of pain, but also paralyze the natural emotions of humans. There are people who, after a few months of taking the drug, begin to feel like a soulless corpse. Not sad, not happy, not angry, not loving, and especially, no longer have the desire to live, no longer have the motivation to wake up every day. Some older people confide, "I live, but I don't know what to do." That's not depression. It's the emotional drain caused by the drug. And opioids, if used for too long, also cause constipation, dizziness, prolonged fatigue, which further reduces the quality of life. If you or a loved one are using this class of drugs, the first thing to do is talk to your doctor. Not to stop completely, but to find a safer alternative, or a pain-relieving therapy that has less of an impact on the mind. Because at this age, we don't just want to live without pain. We also want to live with soul, with emotion, and with love. Parkinson's medicine, levodopa. When Parkinson's disease manifests, levodopa is prescribed to improve movement, making daily activities easier. Yes, levodopa helps reduce seizures, improve body flexibility, thereby helping you eat, talk, and walk more easily. But my friend, there is a story that is not entirely happy here. Research shows that long-term use of levodopa can disrupt hormones, leading to a decrease in testosterone levels in the body. The result of this not only affects physical health but also negatively affects the mind. You may realize that, although the drug improves movement, puts the user in a flat emotional state, as if losing everything that makes life joyful. Specifically, you may feel that the desire to communicate with friends and relatives is gradually decreasing. Physiology, emotions, and inner vitality are gradually depleted. And the most difficult thing is that the ability to love something that over time, we have become accustomed to the warm feelings of family and partner is also gradually fading. It is not only a physical change but also a loss of emotions, of the ability to connect with people around. Of course, Parkinson's drugs such as levodopa are extremely necessary to control the symptoms of the disease, helping to improve the quality of daily life. However, if you or a loved one is using this drug and begins to feel like a soulless person, no longer having vivid emotions, take the initiative to talk to a specialist. Adjusting the dosage or applying hormonal support methods can help rebalance the body, thereby maintaining not only physical health but also mental and emotional health, which is invaluable in our lives. Because at this age, we need to live not only to survive, but also to love and share joy together. You just heard a list of 5 drugs that can affect the emotions and mental health of older adults. And I understand that information can make you worried. But my friend, you don't need to panic. And especially don't stop taking your medication on your own. Because every pill has a reason to exist. It helps you relieve pain, stabilize blood pressure, sleep well, or control chronic diseases. However, it is important to take a close look at your own emotions, or those of your older loved ones. Are you becoming calmer? Do you still have joy in your daily life? Do you feel like you are truly living or just existing? If you notice unusual changes in your mood, emotions, or desire to live, don't hesitate. Share it with your doctor. Sometimes just a small change in medication or dosage can help you stay healthy without losing your precious sense of life. And above all, don't go it alone. Let your children, your spouse, your loved ones accompany you, because healthy aging is not just about living long. It's about living happily, living with connection, with emotion, and with love. Dear friend, we cannot change old age, but we can absolutely choose how to live old age. An old age that is not lonely, not emotionally extinguished, but an old age that is lived happily, lived sufficiently, and lived each day to the fullest. If you find this video useful, please share it with those who are taking care of parents, grandparents, or relatives who are taking medication every day. Small action can bring a huge change in someone's life. And don't forget, Subscribe to the channel so you don't miss out on valuable health information for the elderly. Please leave a comment if you want me to do more topics on emotions, spirit, and health of the elderly. Because health is not just about medicine, but about understanding, accompanying, and loving. Thank you for listening until the last moment. I wish you and your family good health, peace of mind, and a day filled with love. See you in the next videos.